Hey everyone, welcome back to BioBulletin. Today we're joined with Dr. Veylan to discuss the relationship between heart problems and skin conditions.
Hi, I'm Veylan, and today we will be discussing how the skin acts as a map to heart disease. There are quite a few skin problems which could translate to heart diseases in the body, and if you know what these skin problems are, it could be quite useful to seeing if you have heart problems, and it could help because a lot of the time heart problems become serious because they're not picked up on early enough.
So the most common skin problem is edema, right?
So edema is a swelling caused by excess fluid which is trapped in your body's tissues. And although edema can affect any part of your body, you may notice it more in your hands, arms, feet, ankles, and legs. If it's untreated, it can cause pain, difficulty walking, stretched skin, increased risk of ulcers, and increased infection risk, as well as some other factors. But edema can be the result of medication, pregnancy, or an underlying disease, often congestive heart failure, kidney disease, or cirrhosis of the liver. Um, you can take medication to remove excess fluid, and that reduces the amount of salt in your that includes reducing the amount of salt in your food, which also relieves edema. When edema is a sign of an underlying disease, the disease itself obviously needs to be treated separately. Like I mentioned, symptoms can include swelling or puffiness due to the tissue um, directly under your skin, especially in your legs or arms, stretched and shiny appearing skin, skin that retains dimples and pits after being pressed for several seconds, or increased abdominal size. Mild cases of edema can result from sitting or staying in one position for too long, eating too much salty food, having premenstrual signs and symptoms, or being pregnant. Whereas it can also be the effect of as a side effect of some medications, including high pressure medications, non-steroidal and anti-inflammatory medications, steroid drugs, estrogen, and certain diabetes medications. More serious links are found between edema and the lymphatic tissue, um, and kidney damage caused from protein deficiency.
So, a little bit about congestive heart disease. So, heart failure means that the heart is unable to pump blood around the body properly. It usually occurs because the heart has become too weak or stiff. It's sometimes called congestive failure, although this name isn't widely used nowadays. So, heart failure does not mean that your heart has stopped working, it just needs some support to help it work better. So it can occur at any age, but it's most common in older people. And heart failure is a long-term condition that tends to get gradually worse over time.
Mm.
So cannot usually be cured, but symptoms are managed and controlled for many years.
Another Another example of a skin problem which causes heart disease is cyanosis. Now, what is cyanosis, you may ask? Cyanosis is the skin turning purple or blue. Now, usually in extremely cold surroundings, the skin will turn blue or purple because of the low temperatures. However, if cyanosis occurs at normal temperatures, that's a sign that not enough oxygen is reaching those certain parts of the skin. There's a problem in getting oxygen to certain parts of the body, it means there's a problem in getting oxygenated blood to those parts of the body, as it is blood, courtesy of hemoglobin, which carries oxygen around the body. The reason why the skin turns blue is because when the blood has a decreased level of oxygen, it changes its color to a darker shade of red, thus reflecting more blue light, which is why the skin appears blue. This relates to heart problems, especially if cyanosis occurs at normal temperatures, as the heart is responsible for pumping oxygenated blood around the body. So a clot or a blockage in one of the blood vessels could stop the flowing to certain parts of the body, and this we call cyanosis, which shows the link between the heart and the skin. Anyone know any others?
So there's also xanthoma I've heard of. So it's a condition in which fatty growths develop under the skin, and these growths can appear anywhere on the body, but they typically form on the joints, especially the knees and elbows, um, as well as the feet, hands, and buttocks. Xanthomas can vary in size, and the growths may be as small as a pinhead or as large as a grape, and they often look like a flat bump under the skin, and sometimes appear yellow or orange. They usually don't cause much pain. However, they might be tender and itchy. There may be clusters of growths in the same area or several individual growths on different parts of the body. Xanthoma is usually caused by high levels of blood lipids or fats, and this may be a symptom of an underlying medical condition such as diabetes, which is obviously a group of diseases that causes high blood sugar levels, cholestasis, a condition in which the flow of bile from the liver slows or stops, cancer, which is obviously a serious condition in which malignant cells grow at a rapid, uncontrolled rate, or side effects of certain medications such as prednisone and cyclosporin. If xanthoma is a symptom, there are also other factors which could cause xanthoma, but I won't go too in detail on them. If it is a symptom of a medical condition, then as with any of these diseases, the underlying condition has to be treated first. But this will often get rid of growths and minimize the size, and are likely that they'll return as well. Diabetes and cholesterol levels that are well controlled are less likely to cause xanthoma, of course. Other treatments include surgical removal, laser treatment with a certain type of acid called trichloroacetic acid, and xanthoma growths can return after treatment. However, which kind of indicates that these methods aren't necessarily going to cure the condition.
So other than xanthoma, I've also researched livedo reticularis, and livedo reticularis is thought to be due to the spasms of the blood vessels or an abnormality of the circulation near the skin surface. So it makes the skin, usually on the legs, look mottled and purplish in a sort of like net-like pattern, and this with distinct borders. And sometimes livedo reticularis is simply the result of being chilled, but it can also be a symptom of a serious underlying condition, such as a vascular disease. And this is where it links to heart condition. So it may occur as a side effect of certain medications too. And there's no specific treatment for it except for cold avoidance, essentially. So in some patients, the symptoms may improve spontaneously with age, but rewarming the area in cases or treatment of the underlying cause could reverse the discolorization. And this net-like pattern can also be a sign of a disease called cholesterol embolism syndrome, which we keep coming back to the cholesterol diseases because they're also quite interlinked with heart disease. And it occurs when small arteries become blocked, and this blockage can lead to damaged tissues and organs. And so it's important to see a doctor to find out whether you have an undiagnosed disease with livedo reticularis.
So, Ashish, like you mentioned, the net-like pattern can also be a sign of a disease called cholesterol embolism syndrome, which occurs when small arteries become blocked. The blockage can lead to damaged tissues and organs, so it's important to see a doctor and find out whether you have an undiagnosed disease. But more broadly, I think being aware of these small signs of heart conditions are key. At first, we may not assume the correlation between the two. Many would see a skin condition and not get overly worried, or like potentially just presume it's not something to like overly linked to anything. But in these cases, as we can see, it's clearly very important we are aware of the other issues they may hint at and how much broader the issue could be than simply a skin condition. Heart disease and all other heart issues are a big deal, and people noticing signs like the ones we've discussed earlier and requesting treatment is vital. I mean, does anyone have any stats or anything to kind of emphasize how big of an issue heart disease is?
Heart and circulatory diseases cause more than a quarter of all deaths in the UK. That's nearly 170,000 deaths each year. That's an average of 460 deaths each day, or 1 every 3 minutes in the UK. So the mortality rate was 251 deaths per 100,000 population. In Scotland in 2016, same year where all this data comes from, the highest death rate with 306 deaths per 100,000 people. And Scotland also has the highest mortality frequency for coronary heart disease as well, with 134 deaths compared to the UK's average of 108 per 100,000 population. Around 7.4 million people have heart and circulatory disease, and they're currently living with it, with 3.9 million men and 3.5 million women. Those in the most deprived, 10% of the population, are almost twice as likely to die as a result of coronary heart disease. And those in the least deprived, 10% of the population.
So those stats are obviously very troubling, but we should take solace with that. The recent advancements in medicine, we have managed to increase the life expectancy of those with heart disease by quite a bit. And problems with the skin may seem relatively harmless and passed off as a bruising, but with the older generation, it could be a symptom of something much more sinister, such as heart failure. So being knowledgeable about these symptoms can really help people around you.
So that's that for today's podcast. I'd like to thank you for having me. And I
Thank
think
you,
it's
Veylan.
You're welcome. And I think it's very important that people are aware of what's on their body, because you might not always think you have heart problems. You may just pass it off as something on your skin. But no, sometimes it could be a lot more serious, and it's important that you take these things seriously. And I hope you've learned something today, because these are important things we're telling you.
Please like the video, subscribe, follow our Instagram and Twitter handles at BioBulletin. We hope you enjoy the video and we'll see you next time. Peace! No, don't say it!
Ashish,